And I know the fine weather makes that even harder. We all want to be outside. We want to be with friends and family. We want to see the mountains and the sea. We want to feel that we can go anywhere. We want to be free. And I know it is very difficult, but every sacrifice that we make is helping to save lives. It's making sure that our health service is not overwhelmed. It's making things a little easier for those working on the front line and those backing them up, whether it's support staff, administrators, or partners at home.
You are doing this, you are making this happen, you are flattening the curve. And you're helping to protect the healthcare workers on the front line who are working so hard for us. You're staying at home to help protect all the people who still have to go to work. And you're helping keep our health service functioning so that we can look after people who get seriously ill. You are saving so many lives. Isn't that an incredible thing to be able to say?
Yeah, just in terms of people going through the airports and also coming over on ferries, I've seen the anecdotal reports, but we have checked this out, and the number of people coming in by ferry is really minimal, and the number of people coming in by flights is down 95%, and those who are Irish people, Irish citizens returning home. But it is something that we're going to keep under review, because we know that in other countries where they've successfully suppressed and contained the virus, like China, for example, like Singapore, their difficulty now is largely imported cases. So, we do know that's something we have to monitor very closely. Just in terms of the restrictions, as you know, they've been extended now, but they won't be eased in one go. They'd have to be done bit by bit, and we'll also have to see whether the virus starts to circulate and rise again once restrictions are eased, because then they might have to be reimposed. So I know how difficult this is. In terms of what we'll be looking at over the next 3 weeks, there's no magic figure, if you like, that we're looking for, but the kind of thing that we'll be looking at will be hospitalisations, whether they're stabilising or falling or increasing. Same thing goes for the number of people who are in our ICUs. Also the number of new cases and the percentage increase in new cases. So there's no magic figure, but it's those kind of things that we're going to have to look at.
Ideally, the reproductive number that the Minister has mentioned of 1 is well below 1, that the number of cases coming into ICU is much lower than we've seen, and that's dropped in an encouraging way, as we've seen in the course of the last week. We're going to need to see that in place, those disease characteristics in place, and then also those arrangements in terms of the public health management, a really responsive, high-capacity system for sampling, for testing, for contact tracing, and for real-time reporting. And we need all of those requirements to enable us to contemplate a change in the measures that are in place at this moment in time.
But the Gardaí do now have very extensive powers that can be used if they have to be used. But let's not use them. Let's all do the right thing. We want to feel that we can go anywhere. We want to be free.
Just what is it that you want to do?
Well, we want to be free. We want to be free to do what we want to do. And we want to have a good time. And that's what we're going to do.
Well, when, baby? Let's go.
We're going to have a good time.